to address high costs of private healthcare will do nothing to advance urgently needed reform of both public and private healthcare. Dr. Simon Strachan, Universal Healthcare Access Coalition Steering Committee member, joining us on the line now. Welcome, Dr. Strachan.
Good morning. Thank you very much.
Why do you, as the UHAC, believe the government's proposal will not work to reduce private healthcare costs?
Yeah, so I think that's the first point is that we all want private healthcare costs and the rising inflation of healthcare prices to be contained. We all understand that healthcare healthcare inflation rises at about 5 or 6 percentage points above CPI every year, and that's just making it unaffordable for people. So absolutely, we need to get involved in this. What has been gazetted, however, has, to make it simple, in our opinion, 3 major problems. The first is the way the exemption is being utilized. The second is the system that is suggested for tariff determination. And the third is that these are not health marketing inquiry recommendations as recommended by the HMI.
So you want complete implementation of the HMI recommendations. What will that look like?
Okay, so let me, perhaps just to frame this clearly, let me just read very quickly to you, it won't take long, from the HMI recommendations. Remember, the HMI recommendations found that there had been inadequate stewardship of the private sector with failures that included the Department of Health not using existing legislative powers to manage the private health market, failing to ensure regular reviews as required by law, and failing to hold regulators sufficiently accountable. As a consequence, the private sector is neither efficient nor competitive. Our recommendations, this is the HMI, focus on the key interventions as a structural, holistic reform to correct competitive distortions, improve access to, and increase the affordability of private healthcare. The interventions which we recommend should be viewed as an integrated whole, and market failures may persist if a partial approach to implementation of the recommendations is adopted. So what this means is that in looking at costs in healthcare, you have a supply side, you have a demand side. Supply side is healthcare professionals and all the costs that are related to them and the prices they charge and the services they use. The demand side is how the schemes and the hospitals work. And the HMI recommendations were all-encompassing of both supply and demand side. And if you cherry pick certain things, you're not going to have the overall effect where the market is going to correct, where competition will be improved and your prices will lower. So if you, for example, as suggested in this gazette, here they are looking at the prices that doctors charge only. Hospitals are excluded, medicines are excluded from this exemptive process. So if we look at what doctors charge and we relate this to what you would pay if you went in for a hospital admission, let's say you needed an operation. When you got your bill back, you would notice that the amount of that total bill that doctors charged would only be between 15 and maximum 20% of the entire bill. There's so much else that goes on outside of that is necessary to pay attention to and to bring into any kind of reform process to actually have a meaningful impact on the cost of healthcare delivery.
Okay. So there's some concerns that you have around proposed block exemption as well for medical schemes and private healthcare providers. What are those concerns?
Okay, so again, in the HMI recommendations, they spoke about establishing what they call the supply side regulator for health, an independently governed a body funded by the medical schemes, a little bit like the CMS is at the moment, to regulate healthcare prices. Within this framework, there would be a multilateral negotiating forum. Now, that's an important phraseology because that's used in the Gazette as well, multilateral negotiating forum. But in the HMI, it says this has to be an independent and transparent public entity in line with international practice, where there is a clear shift towards regulatory independence in the healthcare sector. Independence is important, particularly in a market where there are concerns of regulatory capture, regulatory failure, and lack of stewardship. So if we're going to set up a tariff determinating structure, it has to be free from political interference. Otherwise, this becomes purely a tariff setting process. And in simple terms, what it means, it kind of blurs the line between regulatory oversight and direct market intervention. So there has to be complete independence of this regulatory process. Obviously, the establishment of the system is overseen at national level. We understand that. But the process has to be free from that for it to be fair. You know, there've been many attempts over the years until about 2010 to try and institute something like this. But it's always fallen foul because of government interventions and government having more than just oversight in the process. And a simple example, for example, would be that prices that will be determined would be based on what healthcare providers working in the public sector would be paid, and then extrapolating that to the private sector, forgetting that in the private sector, we pay that at 15%, in the public sector you don't. In the private sector, we need to be able to have a practice and pay market-related rentals and run software programs and have staff, et cetera, et cetera. So those costs of running a practice have to be factored in to the prices. And that has always been a major stumbling block. So when there is regulatory interference at a national level from the Department of Health in these processes, we really are in a situation where we are not able to adequately negotiate. Because remember, in the gazetted block exemption, the Department of Health will appoint the committees, will set the regulations, will be judge and jury and arbitrator of all the decisions that are taken. There's no independence in that whatsoever. Health market inquiry recommendations, and in fact, a policy that the current Minister of Health was party to developing in 2010, which was put on the back burner when the NHI started to come into being, includes all of this, where there needs to be independence of the negotiating forum, and there needs to be a fair arbitration process to ensure that that nothing is deadlocked or logjam, that you do in fact end up at a reasonable price. But you can't have a situation in an open market where there is such regulation and interference potentially from the department.
So how does the Universal Healthcare Access Coalition suggest the government address healthcare reform instead of implementing partial measures?
Okay, so for example, let me just quickly go back to this gazette, it'll help explain it. If you look at what's included in this block exemption, there are three facets. The first is collective determination of health service tariffs. The second is collective determination of standardized diagnoses, procedures, medical devices, and treatment codes. So everything that you do in the health sector has a code, whether it's a medication you get or it's a procedure, and that code is what describes the service that you perform. So there are codes for everything, so that's the second one. And the third is the collective determination of quality measurement metrics, medicines, formulas, and treatment protocols. Now, the first one, the collective determination of tariffs, absolutely we need an exemption from the Competition Commission, but it has to be one that doesn't appear ultra vires from the start, that is allowed to be independent. The second and third, around codes and all the other things, these are scientifically determined. This is not something you negotiate. These are things that are based on science. There's no need for an exemption for this at all. It just needs the Department of Health to set the regulatory environment where this can happen, or put the request out, or direct the process. So the problem has been that over the last 15 years, there's been no regulation of the health sector from the government at all, the private health sector at all. Health market inquiry recommended that. So what they need to do is, sure, set up the exemption, set up the tariff determination system as is suggested in health market inquiry, and then implement the rest of the health market inquiry recommendations, which requires regulation from a willing, engaged government. That's what needs to be done. It's kind of looking and going, the blueprint is there. We've all been saying in every single one of the submissions we've put in, the discussions that we have, the platforms that we've created, we're all saying the private healthcare system needs regulation and governance. The blueprint for that is health market inquiry recommendations. The result of that, through better governance from the supply side and the demand side, is better control of costs, not fixed tariffs, but better control of costs. It will bring down the cost of private healthcare, and we'll then be able to move forward in an era of health reform and bring both the public and private sectors together.
I think just to bring people into the center of this conversation, what would you say is the main criticism of government's approach to regulating private healthcare tariffs and price setting?
So unfortunately, when we look at this, the major criticism is that they want to be judge, juror, arbitrator, in control of, set everything, and drive it to panel beat the private sector into what they envisage it should look like for the implementation of NHI. So why, for example, why is this block exemption only for 3 years? And why is it that this is not a true exemption? Because this, in fact, is an exemption that is being used to create legislation, to create a policy framework. That's not what exemption should be used for. But why is it only 3 years? Because the National Health Act says that the NHI should be implemented in 3 years' time, which is 2028. That's why this is an interim block exemption. And if you look at the discussions that we've had with members in the department, we were told, stop doing what you're doing. Stop trying to get coding fixed. The NHI is going to take care of all of that. Well, we don't agree with that at all. But that's the problem. The problem is that there's this vehement anti-private sector approach. There is this drive to make the private sector as cheap as possible, available to everybody. I mean, if you follow the NHI acts, it suggests almost that as private sector, we would be working for government, so to speak. Our supply of patients will only come from government sectors. So I think that's what it is. There's too much will to control everything and to get involved in regulation and discussions where there actually is no place. There needs to be market reform. We need to be able to, and the reason there's no market reform is because there's no regulation. But this is not the way to impose that regulation where you become all-encompassing, all in charge, make the rules, hire and fire at will.
Yeah, and I think we have a better understanding. We need some more time on this particular topic to understand it a little better. An important contribution that you've made there, Dr. Simon Strachan. We appreciate the heads up. Brings the time now to 12 minutes from 12 o'clock. Zabalaza Artistic Director and Curator Mdu Kweyama joins us in a short while. We'll talk about the Baxter Zabalaza Theatre Festival, the 15th such festival, next.
John Maytham on Cape Talk.
Weekdays, 3 to 6 p.m.
Cyril Ramaphosa goes to Johannesburg and he goes, oh my goodness, this place is in terrible shape. At least he did not say he was shocked. Are we not entitled to believe that if the G20 summit were not happening, he would be less disappointed, less crestfallen? Why are you disappointed? Why are you crestfallen? Why is Panyaza Lesufi apologizing? It's your fault. Makes me mad.
Getting you home.
Afternoon Drive with John Maytham.
Every weekday, 3 to 6 p.m.
Only on Cape Talk.
Join the conversation.
In business, a rand saved is a rand earned. And almost 100,000 businesses trust OUTsurance.
Switching to OUTsurance has definitely saved me money. 2,107 rands per month. I would recommend OUTsurance to all business owners because they will definitely save money. With OUTsurance, you always get something out.
For your business insurance, contact OUTsurance to see how much your business could save. SMS quote to 38798 for immediate cover or visit outsurance.co.za today. A licensed insurer and FSP. T's and C's online.
At Cape Talk, we love to talk the talk. And when it comes to protecting you,